there, my name's Kelly.
Hi, I'm Aaron.
Nice to meet you, Aaron.
Thanks.
What brings you in today?
I was hoping to chat a little bit about colon cancer and see if there's anything I can do to maybe lower my risk.
Okay, we can definitely do that. Why don't you start by telling me a little bit about yourself and your overall health?
Okay, I'm 35 years old, single, or not married, and I'd consider myself in good health. Seasonal allergies, but nothing major.
Want to scoot just a little bit closer for me, Aaron? I'm having a hard time hearing you.
Okay.
Thanks. Okay, well that's good that you're healthy. Have you had any major illnesses in the past year?
No.
Good. Any hospitalizations for any reason?
No.
Okay, so what prompted your concern for colon cancer?
Well, it's sad, but my mother recently passed away with colon cancer, and just seeing her go through such a, you know, terrible time really kind of opened my eyes and made me concerned.
I'm really sorry to hear that, Aaron.
Yeah.
It's really hard to lose somebody.
I know.
Can you tell me a little bit about your support system?
Well, I've got my dad. I'm pretty close to him. My girlfriend, sister, so just some family that I'm pretty close to. I
Good.
talk it through with them.
It sounds like you have a pretty good support system
Yeah.
in place. Good. Okay, well, why don't you tell me a little bit more about your family history? You told me about your mom.
Mhm.
Is there anybody else in the family with a history of colon cancer or any other type of cancer?
Grandfather on my mom's side had colon cancer and passed away, and then a great aunt, died of cancer. I don't know what kind.
Okay.
I think that's it
Okay.
that I can remember.
Okay. How old was your mom?
She was young. She was in her early 60s.
Wow, so young.
Yeah.
And how about your grandfather and your mother's aunt? How old were they when they passed away?
They were a little older, 70, early 70s, something like
Okay.
that.
Okay.
Yeah.
Is there anybody else in your family that has died of another kind of cancer, or anybody in your family who's alive and has cancer?
My sister actually just
Oh.
got diagnosed with early stage ovarian cancer, but I think they caught it early, but yeah.
Oh,
My
wow.
sister.
Sorry to hear that.
Yeah.
I am glad it's in the early stages.
Yeah,
That's a good
me
thing.
too.
That's a good thing.
Yeah.
Okay. So, based on what you've told me about your family history, what comes to mind is a disease called Lynch syndrome.
Lynch, never heard of it. What is it?
Well, I'll describe it to you. It's referred to also as hereditary non-polyposis colon cancer. And basically it's a disease caused by a gene variant that increases your risk for colon cancer and some other types of cancer. In your sister's cases, it could very well be ovarian cancer.
How do I know if I have it?
Lynch syndrome is diagnosed based on family history and genetic testing. And just based on what you've told me, I do think it's something that we should consider. There's a clinical tool called the Amsterdam criteria, and it's used to assist in the diagnosis of Lynch syndrome. And I'll show it to you. I can't make a diagnosis, but it's just something that we can look at together to see if you might qualify for any of these. So here it is, and it says there should be at least 3 relatives with Lynch-associated cancer, and it sounds like you have 3 relatives who had cancer. We don't know if they had Lynch syndrome, but
Right.
it's a possibility.
Okay.
And at least 2 successive generations should be affected, and that kind of also affects you because there's been a couple generations.
Yeah.
At least 1 should be diagnosed before age 50, and unfortunately your sister's 40.
Right.
And anybody in the family who has cancer should have their tumors tested. So based on this criteria, I do think it's something that we need to keep in mind. There's tumor testing, which might benefit your sister, and they can actually take a piece of the tumor and see if there's that gene variant. For you, that doesn't apply. There's also something called molecular genetic testing, and it basically just identifies if you have the gene variant. And it's done from saliva or a dried blood spot. So I think that's just something that we might want to keep talking about.
How common is it?
Well, about 1 in 440 Americans has Lynch syndrome. However, most of them are not diagnosed. It accounts for 2 to 3% of all colorectal cancer diagnoses. And also, a person with Lynch syndrome has a 52 to 82% chance of developing colon cancer.
Wow.
So it's a significant risk factor.
Wow. If I have it, how did I get it?
Well, Lynch syndrome is passed on in an autosomal dominant pattern, which means only one copy of the inherited gene is needed to cause it. So one of your parents passed it on to you. Probably your mother. If you have this gene variant, since your mother died of colon cancer, she probably may have had it. But it is important to note that not all people with Lynch syndrome develop cancer. So, I don't want you to think if you have it, you're doomed. It just increases your chance. Children have a 50% chance of inheriting the gene variant if you have it. So it's something to consider. And the reason I tell you these things is because the earlier we know that you have it, then the stricter surveillance we can do and screening and do all of that to prevent it from reaching, a devastating point.
What are the treatments for it?
Well, for people who have Lynch syndrome and do not have cancer, it's strict surveillance, which means you will start colonoscopy screening at age in between 20 and 25, or 2 to 5 years before the youngest diagnosis in the family. And in your case, your sister, let's say that you have Lynch syndrome, your sister was 40. So that means you're 35, this is the perfect time to begin screening. Any non-cancerous polyps should be removed. And there are some research studies out there suggesting that taking a low daily dose of aspirin can reduce your risk. Those studies are still ongoing, but they're very promising.
It's a little scary, but what's the next step? Do you think I have Lynch syndrome?
Well, I can't give you a diagnosis, but based on your family history, I'm going to recommend going to see a genetic counselor to verify that you should have genetic testing. I would also like to recommend that you start thinking about scheduling a colonoscopy. I can even have your doctor put in a referral for you. Your sister's the youngest in the family to be diagnosed, so I think it would be important to bring her in and sort of start talking about the process.
It's a little overwhelming.
It can be really hard to receive difficult news. I really understand. And I don't want you to think that I'm diagnosing you with Lynch syndrome. I'm just trying to give you all the information. And if there's anything that I can do, I'm here to help.
All right. I'll probably have to talk this over with my girlfriend and probably my sister, see if she wants to get some testing done. So.
Yeah, I agree. I think that because your sister has ovarian cancer, and actually ovarian cancer is one of the cancers that Lynch syndrome can cause, she might consider tumor testing. It can be very hard and sensitive to talk about something like this.
Yeah.
So I just want to reiterate that I'm here to help in any way I can. I'm happy to have that conversation with her. And there are also tons of online resources. There's actually one that comes to mind, and it's called the Colon Cancer Alliance for Research and Education for Lynch syndrome, and that would be a really good site for you and your sister and anybody else in your family to look at. There's also the Cancer Community Center here in Portland, and their phone number is right here. I can write it down for you, 774-2200.
Okay, thanks.
And again, if you have any more questions, you can call anytime.
All right.
Do you have any questions right now? We've gone over a
No.
lot.
I don't think so, but you've given me a lot to think about.
Yes. I have, and again, please don't hesitate to reach out. I'm here to help and support you in any way that I can, and I think the fact that you are here and doing this is what you should be doing. You're doing the right first step, and you're taking charge. So, great job for coming in.
Thanks.
Okay.
All right.
Is there anything I can do for you today?
No, thanks
Okay.
for your time.
Thank you very much,
All right.
Aaron. Okay.